Hydrotherapy Theory and Practice, Part 33. As you navigate any health challenge, it's always recommended that you partner with a medical practitioner that shares your philosophy of the care of the human body in disease and in health. The information shared in this presentation is meant to educate and improve your wellness toolbox and aid in returning to health if sick and maintaining good health when well. It should not be construed as medical advice, simply as tools that have been used successfully by others in similar situations. As always, investigate and verify any treatment, protocol, or procedure for yourself, not blindly accepting anything without doing your own due diligence. Thomas Edison said in January of 1903, as quoted in the Newark Advocate, "The doctor of the future will give no medicine, but will instruct his patient in the care of the human frame, in diet, and in the cause and prevention of disease." Very forward-thinking statement. But even before that, in 1885, it was stated that there are many ways of practicing the healing art, but there's only one way that heaven approves. God's remedies are the simple agencies of nature that will not tax or debilitate the system through their powerful properties. Pure air and water, cleanliness, a proper diet, and purity of life, and a firm trust in God are remedies for which the one of thousands are dying. Yet these remedies are going out of date because their skillful use requires work that the people do not appreciate. Fresh air, exercise, pure water, and clean, sweet premises are within the reach of all, with but little expense. But drugs are expensive, both in the outlay of means and the effect produced upon the system. 3 John 1 verse 2, even before that, said, "Beloved, I pray that you may prosper in all things and be in health, just as your soul prospers." It's important to know that our soul is a key component to our physical and mental well-being. In Romans, Paul states, "I beseech you, therefore, brethren, by the mercies of God, that you present your bodies a living sacrifice, holy, acceptable to God, which is your reasonable service. And do not be conformed to this world, but be transformed by the renewing of your mind, that you may prove what is that good and acceptable and perfect will of God." In the ministry of healing, it was stated that the knowledge that man is to be a temple for God, a habitation for the revealing of his glory, should be the highest incentive to the care and development of our physical powers. Fearfully and wonderfully has the Creator wrought in the human frame, and he bids us make it our study, understand its needs, and act our part in preserving it from harm and defilement. It's a high calling. And as we move into our topic for today, we'll continue our survey of conditions and their potential treatments with hydrotherapy. So this is the third section. We're looking at possible conditions and some suggested approaches that have been used successfully in the past. And you want to be sure that you have the supplies necessary for them, and if necessary, review previous episodes that talked about the various specific treatments that we referred to here. So generally, improving nerve action, you want to do a spinal alternate hot and cold. If you have irritable nerves or exhausted nerves, a neutral tub bath can be beneficial. Neuralgia, use a revulsive compress. So neuralgia is a pain along a nerve pathway. Sometimes that's what's seen in something like shingles, where it follows a neurological pathway. The figure on the right shows the changes in vasculature with a hot and cold alternate compress. A would be when it's hot, you have vasodilation, blood flow comes to the surface and fills the capillary beds. And B, you've applied cold and it drives it away back to the core of the body. So the skin has less capillary action near it. And this can be used reflexively and as well as deep body parts through fomentations and heat applications and general water stimulation. C and D are other types of inflammatory areas. Typically, blood is drawn to areas of inflammation, and you can accelerate that through the pumping action of hydrotherapy, hot and cold, to and from a particular area of distress. Neurasthenia is an emotionally charged individual. Fatigue, headache, lassitude, irritability are the symptoms. An abdominal bandage can be helpful with hydrotherapy elements applied. Brachial neuritis, so that is arm inflammation. Hot shower can be helpful. Multiple neuritis, neutral tub bath. Basically, that's inflammation of the nerves. A revulsive compress. We can see the revulsive compress being illustrated in the capillary net, the blue representing the veins, arteries represented by the red, and we have little minuscule blood vessel musculature that can close off and isolate various parts of the body when it is addressed with cold. So that's going to be vasoconstriction versus vasodilation. So it's going to draw the blood back to the core. And this shows how it will help the spine. So you can see this as a person laying on their back. You can see the spinal column along the lower portion of the diagram and how it can have the blood flow to and from it. So nicotine is a toxin that you want to have eliminated when you're attempting to cease smoking. Sweating wet sheet pack can help in the elimination. Any kind of sweating is going to help eliminate toxins from the body. And the hydrotherapy can aid in that, not only washing it away, but drawing it out. A nosebleed can help be mitigated with a hot foot bath, essentially causing vasodilation at the lower extremity, drawing it away from the head and away from the area of bleeding. Obesity can be benefited by a steam bath. It's not an exclusive remedy. You would use that in conjunction with diet and exercise. Sweating wet sheet pack helps to aid in toxin removals because as fat is reduced, toxins are liberated and need to be excreted from the body. Pain from edema or sprains, a cold compress, an ice bag can be used to help reduce swelling. Limb paralysis, an alternate compress, again that's going to be increasing in the circulation to the area and increasing the ability of the body to heal. Parametritis, revulsive sitz bath, that's a urogenital infection in a woman postpartum, generally speaking. Pharyngitis is the pharynx is inflamed, so like a hoarseness or sore throat or strained voice, a throat compress can be very beneficial in that regard. And the diagram is demonstrating that or showing that, particularly in the lower four diagrams. Peritonitis is an abdominal inflammation. You can address that with hot packs or with ice bags in combination. So you can use the various purchased types of hot packs, but you can also use fomentations. Peritonitis is an inflammation of the inner lining of the abdominal wall, and that is usually to a fungal or a bacterial infection. They should not be there, and they can come from different things, botched surgery, trauma, cirrhosis of the liver, stomach ulcer that burst to the exterior, in particular appendix that bursts, diverticulitis that has ruptured diverticuli that access the internal space, and there's a variety of different symptoms associated with that. Hot packs can help with the abdominal pain, distension of the abdominal area due to bloating and gases in the abdominal cavity, fever, nausea and vomiting, diarrhea, reduced urine output due to kidney function reductions, fatigue and confusion. A variety of different pelvic issues can be addressed with hydrotherapy. So cramps and congestion both can respond well to a hot foot bath treatment. Circulation, stimulating the circulation in the pelvic region. Sitz bath, much more commonly used in the past than today. Inflammation, a cold sitz bath. Anytime inflammation needs to be reduced, cold is a great way to do that. Heat tends to promote inflammation, but used in combination with hot and cold, it can help the flow of blood through the area and reduce the overall cause of it. Pain, pelvic pain, a very hot sitz bath, and a variety of different issues can be addressed through sitz bath. Now you can do that in various commode varieties, but those aren't as thorough or immersing. The typical wash tub, as seen in the diagram, can be utilized, or a tub can be used for doing a sitz bath. And in the old days, they actually had very nice reclining sitz bath chairs that worked out really well. Haven't seen these for sale or in use. This is an antique version, but they looked actually very comfortable for a sitz bath. Skin sensitivity to plants, a soda alkaline bath, and this could also be for bee stings and wasp stings as well, other insect bites. But systemic surface body trauma from plants like stinging nettles can be used just by dipping your hand into the bath, or it can be a whole body bathing depending on the severity. So poison ivy, sumac, poison oak have oils that can get on the skin and cause welting and weeping. and that can also be minimized by soda alkaline bath. Pleurisy is lung sac inflammation. The lungs on the right, that's the left lung that's being shown there, has 2 lobes, and you can see the red indicating inflammation. Basically, there's a bacterial inflammation that causes sticking of the membranes, and every breath that is taken is painful because of the sticking of the membranes. A normal pleura has synovial fluid, or at least a fluid, a lubricating fluid in between the membranes of the sacs that hold the lungs. So chronic and alternate compress can be helpful for chronic pleurisy. Congestive or general pleurisy, fomentations, or heating chest packs can benefit that condition. Pneumonia, a dry chest pack can be used, but only for the acute early stages. Other stages, an alternate compress or full hot blanket bath heating pack or heating chest pack. This person in the x-ray has double pneumonia, and that's the confirmative way for diagnosing pneumonia, is through looking for the fluid that is being retained in the lungs. Essentially, that's drowning at the surface if that continues to progress. So you want to have that fluid be pulled off from the lungs, either physiologically, and sometimes they actually have to do a drain. So nocturia, so that basically urinating at night. Most people shouldn't have to get up during the night to go to the bathroom, and that can sometimes be an indicator of increased prostate hypertrophy and revulsive sit baths. Basically, that's a change in temperature, a rapid extreme change in temperature, so back and forth alternate, and you would need 2 containers to do that, 2 sitz bath chairs or tubs in order to accomplish that, but that can be beneficial in helping mitigate that issue. Puerperal infections, a hot pack with ice can help with that infection reduction. And then avoiding pus formation, an alternate compress, essentially hot and cold, acting again like a mini heart, moving blood through, carrying away toxins, pulling in nutrients, and then driving the blood away again rapidly with the toxins. So in and out, a 3-time alternation with a final quench with cold is the typical duration and sequence for doing the alternate compress for improving circulation.
To be aware of new videos like this one, be sure to subscribe to the Preparing for the Time of Trouble channel. For more free videos and downloadable audio podcasts, as well as handouts, go to www.preparingforthetimeoftrouble.com. Topic categories include recordings of live seminar presentations, country living, sustainable gardening, homestead remedies, how to be self-sufficient when the grid goes down, wild edible and medicinal plants, hydrotherapy, and end-time Bible prophecies. To take advantage of these free resources, go to preparingforthetimeoftrouble.com.